So filler injections can and do go wrong. I'm going to show you injections today along a jawline. I'm going to get your feedback of what you think. Is it wrong? Is it right? Does it look horrific? Understand this isn't makeup. If you're thinking about getting injections, you should watch this video so you can see what to expect, what can go wrong, and what you mentally can take going through the process and for the products to integrate. If you've gotten fillers already and you know about it, you'll find this quite interesting to see, and your choice of product may or may not change. If you're a DIY, a do-it-yourselfer, and as I always say, just don't harm other people, you'll see why I get 20 or 30 inboxes to my Instagram a day from people who've done things and panic. Because when you see this video of what I'm doing to the patient, I would panic too if I wasn't assured of what was going on. But you'll comment and you'll see. At the end of the video, I'm also going to show you some video footage of injections in the lower mouth to help lift the edge in the corners of the mouth. In this video, this is a 49-year-old female getting injections. So here's jawline injections, and I'm using a micro cannula. I'm creating the opening with a larger needle, but look where I'm making it, and you see a little bit of blood there. A very dangerous area because the most important vessel in the face, or at least one of them, one of the largest, the facial artery is right there. Now it's okay to go through the artery, but you shouldn't inject in it, of course. And it communicates to the forehead. So yeah, you can inject something there and have a problem all the way to the forehead. So what I'm doing here, I'm using calcium hydroxyapatite. It's a very firm filler, and I'm recreating the gonial angle. Now this patient would have bone loss. At 49 years of age, there's going to be an element of bone loss. So picking a high G prime or a firm product will help. However, a lot of people on this channel ask me, can things be done? Well, it could be done, but should it be done? And you'll see here, I'm holding my finger along the edge of the mandible. That ensures that I'm putting it in exactly the right place. This is a non-dissolvable product, and when you see if things did go wrong, that's a problem because you can't simply reverse it. So you have to be very precise in where you put this product. And of course, calcium, it's not going to look good if it's that firm. Have a look at the transformation here. You'll see a sharp jawline. I want to stop it right here. If you have a little look at the edge of the jawline here, you can see it's very irregular. There's bumps or lumps. If you were getting a treatment done, would you go home looking like that? Would you be happy? Would you freak out? When you hop onto Google, you're gonna read so many things. You're gonna reach for your bottle of Xanax. You're gonna be scared. And I wouldn't blame someone. And part of that is having someone who's done a lot of procedures who can reassure you whether that's normal or not. Now, you see the lumps and bumps. Of course, it's calcium. There's a cannula used. This will be totally normal. That's what you should see. We're creating a perfect gonial angle. And remember, what's it supposed to be? The male is around 100 degrees. The female, we want around 120 to 140. And if you see here, it's that perfect 120 to 140 angle, but it needs to be firm. This is a 49-year-old, not a 29-year-old. The bone structure is very different. This will take a couple weeks to settle in and look perfect. Do you have that time? So fillers are a tool, and you can use different ones, but to get an amazing result, a lot of times there's a level of downtime and acceptance of imperfection. So here's a little bonus footage so you can see anyone that wants a better jawline also wants a better chin. Oftentimes that needs to be done. Here I'm using a droplet technique to lift the edge of the mouth. Small boluses around that all-important modiolus, where those muscles come down from the upper face, and the risorius from the masseter. Here I'm injecting the chin for chin projection. Oftentimes an anterior projection of the face, or that nasion to chin, is an attractive look, and I'm bolusing a large amount of product in that chin to get the forward projection. Once again, there are important vessels here. There's a branch along that facial artery that comes up, the ascending mental branch, and that's very important to avoid. And that's why one might choose a dissolvable product in this region. You can see the choice of product. Again, it's a tool. So you could put the calcium here, but then you can't reverse it if you had a problem. So there are many tools in our practice. Which one we choose is based on the best outcome and the safest procedure for the patient. So a lot of people ask that question, can this be done? And can it or should it is always what I say, should it? Here again on the other side, I'm using that droplet technique. If you're going to have a stronger jawline, if you're going to have a forward projection and a beautiful projection of the chin, why would you want a downturned mouth? This is a complete case. I'm going to show you the before and afters. I used a total of 10 mLs of different fillers in the face. Again, at the age of 49, you're not going to do 1 to 3 vials, and you're also going to include collagen stimulators with that. The benefit versus surgery is you can avoid or delay it for a period of time, but also this can all be done in one sitting and over the course of a few months, so no surgical procedure needs to be carried out. But certainly by the age of 50, of course, a facelift is in the cards. And here I'm just going along that melo-mental fold at the edge. You can see the chin turn up. You can see the edge of the mouth turn up, and you can see a beautiful angle to the jaw. So I will get to you the full before and afters and the complete injections, because I did the upper brow, we did the high cheek, and we did the jawline, chin projection, and of course the edge of the mouth, all in one visit. So I think you'll enjoy that. If you're considering injections, keep those factors in mind, that it isn't makeup. There are many tools we have to choose, and you want to pick a practitioner who you feel comfortable with and has the experience and matches the expected outcome that you are accepting to go through a procedure like this. I put a complete playlist up here on dermal fillers so you can watch further filler injections. If you like those, stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.